You wake up at 2 a.m., you stumble to the bathroom. You stand there for a full minute and almost nothing comes out. You go back to bed. 2 hours later, same thing. You tell yourself it is just age. You tell yourself every man goes through this. But here is what nobody is telling you. Your body is not just getting older. Your body is sending you a warning, and if you miss it, the consequences can be serious. Today, I'm walking you through 7 specific warning signs that your prostate is in trouble. These are not vague symptoms. These are real biological signals that your body produces when something is going wrong inside. And most men over 50 are walking around with at least 2 or 3 of them right now, without even knowing it. I want you to stay with me all the way to sign number 5, because that one is the sign men ignore the longest. Not because it is subtle, but because it disguises itself as something completely different. Doctors say it is the one they wish men had caught sooner. So stay with me, because that sign alone could change the direction of your health completely. But first, let me give you one number that puts everything in perspective. By age 60, more than half of all men have some degree of prostate enlargement. By age 85, that number is 90%. This is not rare. This is not unusual. This is biology, and the earlier you spot the signs, the better every possible outcome becomes. So let us get into it. Sign number 1, the slow drain. You notice your urine stream is weaker than it used to be. Thinner. It stops and starts in the middle. Maybe it takes longer than it ever did before. Here is what is actually happening inside your body. Your prostate sits like a ring wrapped around the tube that carries urine out of your bladder. When that ring starts to swell, and after 50 it very commonly does, it squeezes that tube tighter. Think of it like someone slowly stepping on a garden hose. Less opening means less flow. What this means for you is simple. If your stream today is noticeably weaker than it was 5 or 10 years ago, that change is not random. That is your prostate sending its very first signal. The action step here is straightforward. Think back to what your stream felt like at 40. If there is a clear difference, write it down and bring it up at your next doctor visit. That conversation costs you nothing. Sign number 2, the 2 a.m. wake-up call. You are waking up 2, 3, sometimes 4 times every night just to urinate. And here's the part that frustrates most men. You get up, you go, and very little actually comes out. What is happening is this. A swollen prostate pushes directly against your bladder wall. That constant pressure sends a false signal to your brain saying your bladder is full even when it is not. Your sleep is being hijacked by a gland the size of a walnut. What this means for you is that one nighttime visit can sometimes be normal, but 2 or more times every single night is a pattern, and patterns always mean something. Track it for 1 week. Count the trips. That number becomes important information at your next appointment. Sign number 3, the burn nobody talks about. A stinging or burning sensation during or right after urination. This one is often prostatitis, which simply means inflammation inside the prostate tissue itself. It can come from a bacterial infection or from chronic inflammation that has been quietly building for months. Either way, your body is using pain to get your attention. What this means for you is that burning during urination is never normal at any age. This one does not go on a watch and wait list. A simple urine test at your doctor's office can identify the exact cause within 48 hours and get you on the right path quickly. Sign number 4, the tank that never empties. You finish urinating, but you do not feel finished. There is that uncomfortable sense that something is still left behind. What is actually happening is that the prostate is squeezing the urethra closed too early, trapping urine inside the bladder. And here's why that matters beyond the discomfort. That trapped urine becomes a breeding ground for bacteria. Repeat urinary tract infections in men are always taken seriously by doctors. What this means for you is that this feeling is not in your head, it is measurable. There is a quick ultrasound scan called a post-void residual test that shows exactly how much urine your bladder is retaining. Ask your doctor about it by name. Sign number 5, the one men miss the longest. A dull, deep ache in your lower back, your hips, or that area between your legs, with no injury to explain it. This is the sign I told you to watch for. Here is why men miss it. The prostate sits deep in the pelvis, surrounded by nerves, muscles, and bone. When it swells or becomes inflamed, the pressure radiates outward in all directions. Most men blame the gym. They blame their old mattress. They blame the long drive. Their prostate never enters their mind. What this means for you is this: if you have been dealing with unexplained pelvic or lower back discomfort that keeps returning with no clear cause, you need a prostate check. Not eventually. Soon, tell your doctor specifically that you want prostate involvement ruled out. Those exact words will get you taken seriously immediately. Sign number 6, blood where there should be none. Traces of blood in your urine or in your semen. The science here is direct. Blood in these fluids means something inside the urinary or reproductive tract is under serious stress. Broken vessels, tissue irritation, or in some cases, abnormal cellular activity that needs immediate investigation. What this means for you is that this sign does not wait for a scheduled checkup. One single episode, even if it seems minor, means one thing only. Call your doctor today, not tomorrow. Today. Sign number 7, the bedroom problem no one admits. A quiet decline in sexual desire, difficulty with erections, or pain during ejaculation. Most men carry this privately for months or even years, assuming it is age, stress, or something psychological. But here's what the science actually shows. The prostate gland is surrounded by a dense network of nerves that are directly connected to sexual function. When that gland is inflamed, enlarged, or under stress, those nerves get compressed. That compression disrupts the blood flow and nerve signaling that your body needs for normal sexual function. What this means for you is that this is not a confidence problem. This is not a personal failing. This is medical, and it is far more connected to your prostate than most men ever get told. Bring this up with your doctor directly and watch how quickly the conversation changes. I want to tell you about a man, 58 years old, fit, active, no major health history. He had been waking up twice a night for nearly 3 years. Every time his wife suggested he see a doctor, he said he was fine. Just getting older. Then the hip pain started. He blamed an old running injury. Kept training through it, kept ignoring it. It was only when the pain stopped responding to anything that he finally went in, not for his prostate, just for the hip. His doctor ran a PSA blood test almost as a routine add-on. The results came back with significantly elevated levels. He caught it, just in time. He told me the thing he regretted most was not the years he waited, it was learning how simple the test was. One blood draw, 5 minutes, a number on a page. That is all it would have taken 3 years earlier, and everything that followed could have been completely different. Conclusion. So, what do you do right now? 3 things. First, get a PSA test. It is a simple blood draw that measures a protein your prostate produces. It gives you a baseline number. Every man over 50 should know his PSA number the same way he knows his blood pressure. Ask for it at your very next appointment. Second, know your 3 protective nutrients. Zinc supports healthy prostate cell function, and most men over 50 are quietly deficient in it. Lycopene, found in cooked tomatoes, has been studied and linked to meaningfully lower prostate cancer risk. And Palmetto has clinical evidence behind it for reducing the symptoms of prostate enlargement naturally. These are not miracle cures. They are smart, evidence-based additions to your daily routine. Third, reduce alcohol, especially beer. Alcohol raises estrogen levels in men, and elevated estrogen directly accelerates prostate cell growth. Cutting back even 2 or 3 drinks a week has a measurable impact on prostate inflammation. Small change, real results. Your prostate does not have to become a crisis. Caught early, every one of these signs is manageable. The men who struggle are almost always the men who waited. You are watching this video. That already puts you ahead. Now I want to hear from you. Which of these 7 signs have you already noticed? Just drop the number in the comments below. Your answer might be the thing that convinces another man watching this to finally make that doctor's appointment. I read every single comment. And if this video gave you something useful today, something you did not know before, hit subscribe. Because every single week I bring you science-backed information built specifically for men over 50 who are serious about their health. I will see you in the next one.